Hello, I'm Kwajalein Kaur. My video is concerning ethics and privacy in healthcare. First, ethics are defined as a set of moral values that we all possess. When we think of ethics, we think of integrity and trust. Being that we all have our own individual values, a standard of moral conduct is needed to ensure that there is one standard for all to follow in the workplace. Exactly who's responsible? Hospitals, physicians' offices, and insurance companies are all responsible for protecting a patient's information. Those entities need to first start off by notifying the patients of their privacy rights. The hospital or doctor's office needs to adopt and implement privacy policies. There needs to be someone who is identified as a trainer that is responsible for providing the training for privacy policies. They are also responsible for the security of the patient's records, ensuring that the information that are in the hospitals or doctor's offices is not readily available to anyone that's not authorized to view them. The information that needs to be protected would first be any information that's personally identifiable information. The conversation that takes place between a doctor, a nurse, and for any other person that is employed by the hospital or the doctor's offices. And the diagnosis and treatment that the patient is being seen for is also information that should be protected. All of those industries are affected by privacy laws. When it comes to privacy and the procedures, there are times when information will need to be disclosed, whether it's with another healthcare provider or released to insurance companies, or even records that a patient may need for their own personal use. For a general release of information, correct information regarding the patient's name and any identifying information will be needed. Verification of address of the healthcare professional that's directed to release the information to. A description of the information that's to be released. Positive identification of the party that you need to furnish the information to. And of course, the signature of the patient to release information to anyone else. And also the time period for which the release remains valid. That's a general list for releasing information to another healthcare provider or hospital. It is also the responsibility of the insurance carrier that will be processing a patient's claims to protect this sensitive and confidential information. First, most insurance carriers have switched from using paper to electronic methods of sending and receiving information, so it's more secure. and not compromising the patient's privacy. Things such as when a caller is calling into the insurance carrier for information, there's a process to authenticate most calls when you call in to an insurance company. They'll usually ask for the member's complete name, of course, their contract number with the insurance carrier, the tax identification number, that is if they're calling from a doctor or a hospital, the member's date of birth, the member's complete address. Usually at least 4 out of those 5 requirements will need to be met before any information is discussed with the caller. This authentication process also includes when there are family members that need to call in for information about another, and that does include a husband and a wife. There are times when the information can be released via the phone call to a husband or a wife. If that person has given written authorization for that person to receive their information, it is usually then given. There are also safeguards around information that is mailed to a patient. An insurance company will give a member an option to have an address that is that may be different from their home address, where information regarding their health care can be sent to, and that also will not be disclosed to anyone else. HIPAA, which is the Health Insurance Portability and Accountability Act, supports the privacy of patients. It was first enacted by Congress in 1996, and it essentially is the law that sets standards nationally on how we use and disclose information as far as the patient's health information and protected health information. In 2003, there was a compliance portion that was added to ensure that these covered entities, which include our hospitals, our doctors' offices, and insurance companies, are complying with privacy procedures and have those in place and employees trained on these procedures. Thank you for listening. This has been my video on ethics and privacy in healthcare. Thank you.